Hi, my name is Dr. Pecoraro. I'm a chiropractor. I graduated from Columbia Institute in 1975, and this is 2011, so that's almost 40 years. And over the years, I, like probably you, have developed variations of certain techniques that have helped me over the years, and I thought I'd bring some of them to you. I want to discourage you, don't use this if you're not a chiropractor because you can hurt somebody. You need to know a lot of things other than what I'm telling you beforehand, which the chiropractors will know from chiropractic school. And I'm going to speak in chiropractic language to discourage others from using it, so hopefully they won't know exactly what I'm talking about. Anyway, this is, first I wanted to show actually a diagnostic kind of technique. Many of you may have the patients bend forward in Adam's position and check out their spines, sort of like for scoliosis or to see where the main areas are. But sometimes the patients can't do that. Their back hurts too much, or sometimes it's inconclusive. And I find that this position that I'm going to show you for the adjustment is also good for diagnostic purposes, similar to Adam's position. And you can tell a real lot. Almost all the patients can do this, no matter how bad their back is hurting. And so you might want to try it and see how it works out. But anyway, what the patient's going to be doing is they'll stand on the end of the table, facing the table, and get up onto their hands and knees onto the table with their head facing the head of the table. So they'll be on their hands and knees right here, and I have them put their forearms down on the table so that brings their spine sort of like this. Now their knees should be, or their thighs, let's say, should be basically at a 90-degree angle to the table. If they're too far back, it's not going to work. If they're too far forward, it's not going to work. So about approximately 90 degrees. And they should hang their stomach down towards the table to increase the lumbar curve. Now in this position, you can get behind them, you can palpate their pelvis or their sacrum and their lumbar vertebrae and get a better idea of any rotations that are still there. Now this is also the way that I would adjust certain people. The patients with lower back problems particularly like this technique. Anyway, I'm right-handed, so in this particular technique I'm going to be using my right hand, so I'm going to be standing on the right-hand side of the table, and the thrust is going to be towards the patient's head and towards the floor at the same time. And the contact is going to be either on the spinous process or the laminar transverse process, whatever you want to contact on. All right? And I'm going to use this type of thrust in that area. And it doesn't have to be a very hard thrust. It'd be almost similar to what you might use with Cox technique, or maybe not quite that smooth, but maybe that smooth, and somewhere in between that and a regular thrust. But you'll notice that the position is very similar to the Gonstead knee-chest table, except for you don't have to have the knee-chest table. You can do it right on your regular table. So they'll be like this, and you'll be contacting either on the spinous process or whatever, and the thrust is going to be in this direction. So try it out, see how it works out for you, and I hope it's helpful. Thank you.